So, hello and good evening to one and all. So, let me start by introducing our today's guest and speaker, Ms. Sonali Srinivasan. Ms. Sonali Srinivasan is a psychologist and psychotherapist. She practices consults at a multi-specialty private hospital in Chennai and also offers psychotherapy services online. She has been associated with the Department of Counseling Psychology, University of Madras, teaching and training postgraduate students since 2018. She completed her education and training from Tata Institute of Social Sciences, Mumbai, and is also trained in clinical art therapy. He has served in the healthcare and education sectors and worked in the areas of child and adolescent counseling, psychopathology, including trauma, anxiety, depression, developmental disorders like LD and ADHD, psycho-oncology, pain management, stress management, and couples counseling. Ms. Sonali is very passionate about psychotherapy, strength-based interventions, and ethics in counseling. She has conducted capacity training workshops for mental health professionals, postgraduate students, and facilitated scientific sessions at national and international conferences. So that was the introduction of our guest and speaker today. Over to you, ma'am. Thank you.
Thank you, Prabal. So, how many of you heard of eczema? Is it an alien term? Okay, there's one person who said they've heard. What about the others? Is it an alien term to all of you? Unknown. Okay.
Ma'am, it's a type of a skin infection, right?
Yes.
Itching on the skin.
Itching of the skin. Okay. And how are you aware of this? Have you come across anybody having this?
Ma'am,
Ma'am, on the news.
I used to
And
have
my cousin.
white spots.
One at a time. Ashish and then Animesh.
Okay.
Ma'am,
Yes,
I've heard
Ashish.
it on the news, ma'am. Ma'am, I've heard it on the news.
Interesting.
Yes, ma'am.
Okay.
Never seen it though.
Mm-hmm. Mm-hmm. Yes, Animesh.
Yes, ma'am. During my teenage life, so I used to have these white spots on my shoulder, and my skin is very dry basically. And so during summer season, I used to get that white spot. So my dermatologist, she prescribed some powder and lotion, something like that. So that's when I heard about this term eczema.
Right. Thank you for sharing, Animesh.
Yes, ma'am.
So, anybody else who is aware of this or has come across this before?
Ma'am, my cousin brother has this disease
Mm-hmm.
because he was studying in a cold place. So at there he got in contact with his roommate. He was having that disease, so he caught it.
Right. So, from what you all are sharing, what have you come across as the most persistent or the predominant difficulty when one has this condition?
I'm shedding of dry skin all the
Mm-hmm.
time
Mm-hmm.
and itchiness of the skin.
Yes.
Itchiness, and also that the spots that doesn't disappear um, like suddenly. It takes time. It takes
Yeah.
time.
Yeah. So,
So it's
irritation,
very much visible on your skin.
it is very much
Very much
visible.
visible on your skin. Yeah.
And that's the thing, right? It's not hidden. It tends to be on your arms, on your legs, in places which are very visible. So that again compounds the psychological impact of it on somebody who has it, because they're seen sometimes they're seen with these patches or rashes, and that can also be discomforting. Besides the irritation, itch, which we call as pruritus, and the inflammation in the first place itself, right? So let's look at this in detail, and also why am I here as a mental health professional, and the mental health aspects related to it, and what could be some inputs for those who have this condition. Okay, so I'm just going to present. Okay, is my screen visible to you all?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Yes, ma'am.
Um, Okay. So if you all have any questions or doubts, we can take them at the end if we have time. In the meanwhile, join me, lend your ears and eyes to this, to my voice in the PPT, and
Sure,
let's
ma'am.
see where it takes us. Okay. So it's a skin condition characterized by inflammation, irritation. Now, what is important is it's a condition which can manifest due to different other conditions triggers. So the triggers could be irritants. In our environment, some harsh chemicals such as the ones listed here, could be pollutants that we are exposed to, could be allergens from the environment, from skincare products that we use, anything with fragrances in them, could also be from food items. So could be from an n number of factors. So eczema can be of different types. We are going to be looking at some common types in this presentation. So some of them that are listed here are atopic dermatitis, contact dermatitis, stasis dermatitis. So before we move on, I think it's important that we understand what dermatitis means in the first place. It is basically a medical condition where the skin is becoming irritated, red, swollen, sore. Sometimes there could be small blisters. So in eczema, we can see dermatitis, and there are different kind of conditions in eczema relating to this kind of dermatitis. So let's look at the ones listed here. Atopic dermatitis. So what does atopic mean? Atopic basically refers to a form of allergy in which we have a reaction. So a hypersensitive reaction, as mentioned, it could be due to various triggers, but in this particular case, it's hard to narrow it down to one trigger specifically. That it is complex. There could be various triggers, and the reaction is not just seen in the part of the body which is in contact with the allergen. It could happen all over the body, different parts of the body. So when that kind of an allergic reaction happens, okay, where it's not specific to the site of contact, then that's called atopic. Atopic dermatitis or atopic eczema is what we are talking about now. Now, the striking thing about this is it happens in children under 5 years of age as well. Okay, so sometimes you could see babies having this, very, very small children having this red patches on their skin. Millions of people across the world, right from newborns to adults, 65 years old and above, live with this condition. It's a chronic condition, which means that it's not something that is really cured, but it can arise at different points of time during one's lifespan. So, of course, there are some statistics and prevalence mentioned here. If you see a study done by the International Study of Asthma and Allergies in Childhood, 2.7% of overall prevalence of eczema among Indian children was noted. Indian children aged 6 to 7 years was noted, and among 13 to 14 Indian children, it was noted to be 3.6. Okay, so eczema is commonly seen, and especially this type of eczema is seen in India as well, and among right from children to older people, as we've mentioned. So symptoms range from excessively dry, itchy skin to painful, itchy rashes. So from it being excessively dry to itchy to even becoming very painful, and the rashes become severe. There are sleepless nights. It interferes with everyday life. However, one thing which should be noted, and which is often missed out or misconstrued, or there is a misconception, is the fact that it's not contagious. Okay, so if anybody believes that it is contagious, then that's only a myth. That's not a fact. The fact is that it's not contagious. Okay, important thing is sometimes these in children, these rashes tend to get missed. It might be less noticeable, especially in darker skin tones. The discoloration in the skin can be seen to be more gray to violet rather than the red rashes that we would otherwise see. Often, again, parents with children having AD might also have misconceptions, so thinking about, that by eliminating one particular food allergen or item, they could get rid of this. But as I've already mentioned, it's this particular kind of eczema is a complex disease and is not related to any one particular factor. There are multiple factors, and it's something that will happen across lifespan. So removing products, indiscriminately without professional consultation can actually in turn cause other health nutritional problems for children, depriving them of some nutrients they would need, during the critical growth phase. And another thing is, some parents might feel fewer baths will help reduce this flare-up. However, research shows that taking short daily lukewarm baths or showers and then helps, because bathing removes the bacteria buildup and germs, which can reduce the skin infections, the flare-ups. Okay, so of course it will have to be very, very gentle, very safe products, but short daily lukewarm baths or showers actually help for those having AD. It can be soothing and prevent bacteria buildup. So in typically it's also sometimes confused with psoriasis. Okay, these are two different conditions. Eczema is common. 1% of children tend to also have psoriasis. What is the difference? Psoriasis causes well-defined thick red scaly patches. So thick red scaly patches, and the areas where it's found also is important to be noted. It's usually seen in the elbows, in the knees, and you could
behind the knees also.
Yeah, behind knees, even on the face, on the scalp.
Yes,
Typically, you see it on the scalp. Okay, and these thick patches of skin with overlying redness. Whereas eczema tends to appear in the crooks of knees, elbows, and psoriasis tends to have milder itching, while eczema we could see even intense itching. However, for a common person to tell the difference could indeed be very difficult. There could also be an overlap. When a dermatologist, diagnoses, they are in the best position to say whether it's eczema or psoriasis. In some cases, children could have both conditions. Okay, so this is important to be noted so that we don't miss out on this as well. Now, looking at also atopic dermatitis that can happen in adults, right? We've said that some develop it as a child and continue to have it across lifespan. In rare cases, it can happen after 18 years of age. So as some of you mentioned, there is extremely dry skin, and skin that is also easily irritable, right? Besides that, you see eczema in the hand, you see eye problems, eczema on eyelids, cataracts. So manifestation again could be slightly different in adults. Okay, and those who had AD for years, like the patches on the skin could have even really thickened, developing a leathery texture due to this. And this thick skin can again itch all the time. So if you notice these kind of patches, if you notice that kind of itching is there in somebody, and even in adults, in adults specifically, you see patches around the eyes, or itching, thickened patches around the eyes and itching there. So then it is important that you recommend that they also consult a dermatologist. Now, if some other signs that can also, severe signs that can be seen are raw bleeding skin, skin which oozes, some fluids, or where there's bleeding. There could be deep lines in the palms, skin infections, other kind of skin infections that come along with this, and of course feelings of anxiety, depression, and then isolating oneself because one feels self-conscious and ashamed on account of this. Dealing with it can get really difficult. So we come back to that aspect, of course, in detail in a bit. And of course, treatment is also something that we will look at shortly. The other kind of dermatitis, which can also be common, is contact dermatitis, right? So when something touches your skin and it irritates it or causes an allergic reaction. Okay, so initially what do you see? The skin becomes itchy, and the more you itch, the more a rash develops. and in some cases you might also see blisters. This again is not contagious. Okay, and contact dermatitis can appear anywhere on the skin, wherever the contact with that irritant has happened, and the allergic reaction can be noticed within instantly to a few hours to sometimes even a few days after contact. But some common cases of contact dermatitis might happen with our hands, for example. If there's frequent hand washing or sanitizing with harsh products, then you would notice this kind of itchy skin, rashes, and sometimes even blisters developing. If you have allergies to fragrances, right, then or personal care products, then again the body parts on which you apply it, the skin surfaces where you're applying it can can become really itchy, followed by development of rashes, especially if there is increased itching. The face, neck, underarms, scalp, and toes of the feet. These are also common places for one to develop contact dermatitis. Okay, so in terms of manifestation and how this comes across, there is a slight difference which we can notice compared to the previous kind of eczema. So to clarify that again further, signs and symptoms for contact dermatitis: again, itchy skin, rash, excessively dry but tender skin, burning, stinging, hives. So when there are round welts or swelling in the skin, fluid-filled blisters, oozing blisters, all these kind of things could be a form of or a sign of contact dermatitis. Now, because so many things can irritate our skin and cause an allergic reaction, it's hard for us to figure out by ourselves, which is why typically consulting a dermatologist and further treatment and intervention from them helps people with this condition. What do? They essentially find out, perhaps do clinical examination and testing to determine what are the allergens, and then treating that surface or that part of the skin where this has happened locally, as well as helping the patients avoid the triggers and allergens, alerting them to the kind of precautions and care that needs to be taken. So only by avoiding the cause can you get rid of contact dermatitis. Okay. Next, the third kind that we are going to talk about in this session is Stasis dermatitis. So we've looked at, what are the two we've looked at so far before this?
Contact and
Contact
atopic.
and atopic. Correct. So the third is Stasis. Now this particularly relates to people who have poor blood flow. Okay, because poor blood flow usually develops in the lower legs. So if there's poor circulation to the legs, then Stasis dermatitis often appears around the ankles. Especially as people age, you might notice elders around you having something called like bulging veins in their legs and the calf muscle. It's a condition called varicose veins. That is an example of such a case where the blood flow to the legs has reduced, and therefore it's causing that poor circulation causes varicose veins. Now that is again one condition where people are at risk to develop this kind of eczema. But nonetheless, so what happens when there is poor circulation? When there is poor circulation, some of the fluid leaks out and stays in the legs. Okay, it's not getting drained effectively as well, causing the legs to swell. And when this happens, a person has venous insufficiency. And the pooling of this fluid, right, in the legs results in the stasis for them. And venous insufficiency, like I said, could occur, as people age due to insufficient and improper blood circulation to the legs commonly. But it could also occur after a bad leg injury, blood clot in your leg, or a surgery that one goes through. Not everyone who has venous insufficiency will develop Stasis dermatitis, but poor blood flow will definitely be a risk factor for it. Okay, and what are some of the warning signs that one has to look out for? If you see somebody with itchy, dry, discolored skin, especially over the varicose veins, which I just explained, or if their skin is irritated, discolored, sore, there's also heaviness and aching, okay, in one or both legs when the person stands or walks. There's swelling on the inside of the ankle, as we've already mentioned, swelling in the leg that clears up when you sleep, but then again reappears when you're out of bed, right? Then these are red flags where a person would need is at high risk for Stasis dermatitis and would need attention. And even if for that matter, even if the varicose vein has gone unchecked, then that also ideally should be given medical attention with a qualified professional or a doctor, right? Proper treatment and lifestyle changes can, however, prevent this Stasis dermatitis from worsening. How? Like, if there are lifestyle proper treatment, of course, in those areas of the leg or where varicose veins are, can help for better drainage and so on. But apart from that, lifestyle changes would increase the blood circulation. Say for example, if a person is standing for long hours, those kind of things need to be ideally avoided if somebody has varicose veins, to prevent them from developing a condition like Stasis dermatitis. However, without proper treatment, it can worsen. It can not only occur, but it can worsen where now you don't have the previous set of symptoms alone, which is itchy, and then you have heaviness, pain, soreness. But besides that, you have you have wounds or sores now. It becomes a thick, scaly skin, deeply pigmented, and in very severe cases, it could lead to shrinking in the lower part of the calf muscle. Also, where you might see pain. Okay, and another thing to note is this should be given attention, because if Stasis dermatitis occurs, okay, this kind of eczema occurs, then two more conditions are known to be common alongside it, to co-occur with it. What are these two conditions? Contact dermatitis, which we've already seen, meaning that skin there will then become all the more sensitive and easily irritable, prone to developing eczema again in that form. And then cellulitis, which can again become a very serious infection that extends deep into the skin. So that is why this is something which shouldn't be ignored. On the surface of it, many times we ignore the changes that happen in our skin. We don't notice, even if there's pain, even if there's intense wounds or sores, and sometimes even the distress and the lack of sleep that it results in, everything is put aside, and one, especially when one has a fast-paced life or a very stressful life, attention is not paid to these conditions, and that could in turn lead to further problems, which is why definitely early intervention is the best case scenario. Like other aspects, other kinds of eczema, this is also not contagious. Now, like I've said, it is common in the lower legs, but it could occur in other parts of the body, but that's very rare. Now, so what have we looked at so far? We've done a quick introduction into what is eczema and some common kinds of eczema, right? And signs and symptoms of that. What to watch out for, essentially. Now, apart from this, I must mention there are further kinds of eczema which you can read upon, but these are common ones which I thought that you all should know about, and therefore watch out for if you notice it among people you know or so on. Now, next is let's move on from the kinds to the triggers, right? Because let me tell you one thing: every person even if different people have eczema, each one's system is sensitive to different aspects and different triggers. So different mechanisms could be at play for any particular person having it. So it's a very individual condition, or it's something that needs to be assessed evaluated on an individual basis and accordingly therefore treated, right? So before moving on to other triggers, let me quickly take you through very briefly into a case of a 30-year-old woman. This was somebody who we saw at the hospital, and this person came in on multiple, came in for 2-3 settings, saying that they're having itching and not able to sleep, and it's disturbing their work, her work, and so on. Blood tests were done, and this person insisted on testing for all the allergens. So a whole list of 30 allergens were actually tested for, and blood profiling was done. But none of those actually, the blood levels of those were not significant to explain her symptoms and distress. The consultant physician suggested checking blood sugar levels, and lo and behold, that was an aspect that had gone unnoticed. Uncontrolled diabetes at the age of 30. Uncontrolled diabetes at the age of 30 with high blood sugar levels was the factor that was triggering eczema in her case. Okay, so sometimes the reasons may not be as obvious or as apparent as we expect them to be. There could be other factors which need to be considered and then given attention. So therefore, looking at other kinds of triggers, like I said, uncontrolled diabetes, where there's that blood sugar level, blood sugar buildup, right? Then that itself predisposes one to have bacterial infections in those makes the skin susceptible, makes them susceptible to bacterial infections, and also severe itching and rashes thereon, therefore contributing to eczema. So uncontrolled diabetes is something that has to be washed out for, and if that is there, definitely the doctor is going to recommend lifestyle changes as well for better management of the blood sugar levels. Another aspect, there could be multiple triggers, but another trigger that we are looking at right now is skin conditions, which by default or which by themselves can cause dryness of skin. Okay, one such example of one such condition is ichthyosis. So ichthyosis again is a genetically inherited skin disorder. So eczema, definitely there could also be a genetic aspect, associated with it. If there's a family history or a tendency in the family to develop it, then the individual has that predisposition for that to get triggered. Now, another skin condition which can be inherited is ichthyosis, and in ichthyosis, dead skin cells actually accumulate. So they accumulate in thick, dry scales on the skin surface, and therefore that makes an individual vulnerable to itch and then develop rashes and get into eczema as well. Okay, so these are also another aspect of another set of triggers, skin conditions that we could ideally look out for. Another kind of trigger, which again could go unnoticed or could be missed, is hormonal changes. Okay, researchers would say that hormonal changes, especially in women, could be associated with that, mainly due to a drop in estrogen. So estrogen, which drop occurs typically during menopause and during pregnancy, or even before the beginning of a menstrual cycle. Okay, so in different phases, you can see a drop in the hormone, in the estrogen hormone in our bloodstream, and on those occasions, there is a risk for eczema getting triggered. So hormonal fluctuations can happen. However, if women notice a connection between periods and of their menstrual cycle and flare-ups, eczema flare-ups, then that is definitely something that they have to bring up with their doctor and get help for. Okay, so these are some triggers. Like I said, there could be many other triggers, other irritants, environmental factors as well. Now, therefore, okay, let's say we understand what kind of a condition eczema is, that it could be of different kinds, there could be different triggers for it. What happens next when somebody has this condition? Ideally, assessment takes place. So what the dermatologist or doctor would look at would typically be about the categorization of severity of eczema. Okay, so in this case, I've in this slide you can see this is what is recommended by the United Kingdom National Institute for Health and Care Excellence (NIH), and they propose a system for evaluation of disease impact on on the quality of life and psychological well-being for individuals with eczema. So let's remember, as with most other conditions, the damage it causes physiologically is one thing, but apart from that, it also affects other aspects of life, right? Their normal functioning, their sleep in this case could be really affected or impaired by it. They may not be able to focus or concentrate on work. If it's particularly severe, they might be worried about it, anxious about it. So it definitely affects the quality of life as well as psychosocial well-being. If there's stigma, they feel self-conscious, they might isolate, withdraw, not engage with their social circles as frequently or as comfortably, as freely as they would otherwise. So to consider, in keeping in mind these kind of impacts as well, this kind of an evaluation into categories of mild, moderate, and severe is done. So you can see the categorization here. Maybe one of you just read it out. When is it mild? When is it moderate? When is it severe?
Okay. And so, shall I read mild one?
Yeah, you can read all three.
Okay. From the top or just the from mild, moderate, and severe?
Only from mild, moderate.
Okay. So mild is areas of dry skin, infrequent itching, with or without small areas of redness. Little impact on everyday activities, sleep, and psychological well-being. The moderate is areas of dry skin, frequent itching, redness, with or without excoriation, and localized skin thickening. Moderate impact on everyday activities and psychological well-being. Frequently disturbs sleep. And on severe, widespread areas of dry skin, incessant itching, redness, with or without excoriation, extensive skin thickening, bleeding, oozing, cracking, and alteration of pigmentation. Severe limitation of everyday activities and psychological functioning, nightly loss of sleep.
Yes. So this gives you a picture of the extent to which it can impact, and therefore the consulting doctors will also keep in mind these aspects when they are assessing the severity of eczema. Treatment, quickly going over it. Dermatologists will look at topical anti-inflammatory preparations, ointments, lotions for that particular area, part of the skin where eczema occurs, to treat that. Moisturization of skin, as many times dryness could increase this condition. And then patients with severe disease might require phototherapy in some cases, which is basically light therapy with UV rays, UVA rays, and UVB rays to prevent bacterial infections. That again, that's a treatment where the cost benefit has to be looked at when that is administered. And then, of course, there could also be immunomodulators to suppress the immune response, which is triggering the inflammation, or in cases where there is a bacterial infection, antimicrobials, and ultimately, therefore, steroids and antihistamines for the allergens. So medication for specific triggers also needs to be looked at, right? Like we've looked at some specific triggers as well. So if diabetes, uncontrolled sugar levels, blood sugar levels are triggering this, then definitely that medication is also going to be important to manage the blood sugar levels to avoid repeated triggering, right? And then triggers relate, they're going to look at lifestyle modification, as we've discussed. In some cases, if there's specific food allergens, then diet modification, minimizing exposure, and then avoiding excessive sweating, tight clothes, because ideally, if it's airy, it can heal better, but if it's completely covered, and then the chances for infection and worsening are also higher. And of course, recommendations for counseling, for coping, for the associated mental health issues that can happen alongside as a result of eczema, but as well as contributing to the eczema itself. Okay, so far you all are here with me. This is all about eczema, different aspects relating to it. Okay, we move on to the next part of our session, which is about the mental health aspects. So mental health can impact eczema flares. Okay, as mental health, I hope with increasing awareness, you all are also aware and of how it's health and well-being is not just subject to physical body and physical well-being, but it's also about our psychological well-being, and mind and body are one system. So the health that you experience in your body feeds off well-being psychologically and vice versa. So it's important to look at the mental health that one has in every aspect of life, and relating to every aspect of life. And with eczema, it's no different, right? It can impact eczema flaring up. So research shows that stress, for example, can cause eczema to flare. It can make the skin itchier. A study noted that stress can worsen eczema because of the way in which it triggers the immune system. So heightened cortisol levels, fight or flight response, and repeated triggering of this stress response mechanisms can affect the skin barrier as well and other systems in the body, and therefore cause eczema to worsen. And then when we talk of stress, I want to mention here that it's not just about those who have eczema, who might need help for it, or who need to, bring down the stress levels or address stress, but it's also family members, caregivers, parents of children with eczema who tend to experience stress, especially if there's significant, disturbance, impairment that eczema is causing their family member. So, and their stress in turn can also rub off onto the person having it, right? Increasing the eczema. So, for keeping in mind best interest of the patient as well as the family members or parents of children who have it, it's important that they also take care of themselves, bring down their stress levels so that they are better equipped to deal with this, and so that doesn't further induce stress for the person having it. So stress is one way in which it can impact, one mental health aspect or issue which can happen and plays a significant role in the flaring up. Now, there are other psychological aspects as well. In fact, a lot of it in terms of dealing with eczema is also psychological, as some of you mentioned how it's visible and noticeable, right? So this is another person we came across at the hospital, a 45-year-old gentleman who was in a routine desk job. Came in with complaints of severe itching, not being able to sleep, and itching all over. So the routine screening, evaluation tests were done, but again there it didn't it didn't add up, and it did not help to really bring down this person's suffering or symptoms. One fine day, the next time when that person came, the physician, and typically this person would wear like a shirt and a pant, so covering most of their body. So the skin surfaces would largely not be visible, right? Those that are covered are not visible. So then it so happened that the doctor happened to notice some rashes on the legs. And then upon complete examination, it was noticed that this person had rashes all over their legs. It was covered by this band, which was, not letting the skin breathe also. And this person was very reluctant and wanted to keep it hidden, because they were conscious about what others would think, that it looks very embarrassing and shameful to have that appearance. And what we must note is the kind of stigma, shame that one might go through on account of this, and then also how it might prevent or interfere with help seeking and actual treatment. It could end up worsening, contributing to worse prognosis or worsening of the condition in the person. And I'm sure this person is not the only such person we come across. I'm sure there are many more for whom the stigma and shame becomes again very, very difficult to deal with. That adds on to their psychological distress and affects their help seeking. So far we've been looking at different factors which can cause the flare-up and impact treatment of eczema. But there are also aspects, mental health difficulties, conditions, issues that are triggered, that are contributed to largely by eczema, that eczema affects a lot. Let's look at that. So eczema can cause debilitating skin symptoms, as we've discussed, can cause sleep loss, because even in the night they're itching, or sometimes they wake up with that intense urge to itch and or burning in the rashes, places where their skin has those patches. And of course, there are psychosocial factors such as self-stigma or stigmatized. Sometimes even others might pass comments on the appearance of those rashes. Shame that one feels, how it might impair not just their sleep, but also their, if it's a child, it might impact their school performance, their self-esteem, their work. For an adult, their work performance, concentration, because to a large extent, sometimes there might be preoccupation with the way the person looks, with the kind of suffering that they have on account of the condition, and whether it will, get better or not. So questions like that, right, that can really cause them distress. So according to a study, people with atopic dermatitis are significantly more likely to experience suicidal ideation and attempts as well. Okay, and definitely researchers have noted that the atopic dermatitis does play a large role in contributing to those suicidal ideations and attempts. So often eczema, therefore, this is not something that we need to take lightly. If we know that somebody is having this skin condition, it's important to diagnose, get them help for that, but also offer support and help and ways of coping to deal with these kind of other aspects or problems that come along with it, right? And other psychological disturbance that somebody goes through, because otherwise it could even lead to suicidal ideations and suicidal attempts, which could be prevented if there is timely help and support also that is given. Often eczema mental health conditions also feed off each other, overall negatively impacting mental health and vice versa. It affects our emotional well-being in ways that I've mentioned already, and connection between eczema and mental health is so strong that depression is seen as a comorbidity of this disease. Comorbidity meaning a condition which co-occurs. And that in turn contributes to further irritability, moodiness, foggy thinking. So you're not able to think clearly, make decisions. There's problems with our judgment, and then lack of interest or initiative to do things, low self-esteem, and so on. So depression, so apart from stress, apart from anxiety that one might experience on account of these symptoms, which we'll also look at, suicidal ideations and attempts. Depression especially is a comorbidity that is seen with eczema. And a recent survey by National Eczema Association in Canada revealed that more than 30% of people with atopic dermatitis were diagnosed with either depression or anxiety. Okay, and what is this connection between skin and mental health? Itchy skin and mental health, right? Why is there such an impact? Of course, we understand the psychological effects that this condition has, the psychosocial impacts that it has. Okay, but there are neuronal at a neuro level. There are connections which result in this kind of mental health issues, right? So these are the parts of brain which are found to be associated with the itch being processed. Okay, so the somatosensory cortex, cingulate cortex, and some more which are listed out here, and the diagram again points to those. But of course, if you're interested, you could look into it further. But the fact is, our skin is our body's largest organ. So when the skin is inflamed, it makes our brain aware of inflammation. How? Through sensations of pain, heat, itch, and discomfort. So parts of the brain which are associated with these sensations tend to get fired up or activated repeatedly, get stimulated by this kind of skin inflammation. And therefore, that again increases, that again contributes to the kind of mental health issues that one goes through, especially contributing to an increased risk for depression as well, right? The sensations of pain, general discomfort, heat, itch that are registered in the brain as a result of the inflammation. Okay, so we are looking at the interaction between the skin and the brain, how activation of certain parts of the brain due to those sensations can contribute to a lot of distress, to depression. These are some signs of depression that we have to look out for. So if we, not just in the case of eczema for that matter, if we come across anybody with such mental health, with anybody in general having such signs or symptoms, okay, then we ideally need to, if we have it, we need to seek help, or if others have it, then we could encourage or help them out with reference or recommendations to mental health, to getting help from a mental health professional, because they might very well be having what we look at as clinical depression, where it is that to a diagnosable extent. Okay, so it's one session is only sufficient to give you an overview about some aspects. So far we've looked at two broad aspects. One is what is eczema and kinds and triggers. Second is eczema and mental health. Now third is, if when one does have eczema and mental health, what are some small, some significant coping techniques, coping mechanisms to deal with this, right? Deal with anxiety, deal with stress. So I think what I'm going to do is to talk about one for each. These are definitely techniques which, a mental health professional, if you go seeking help, will also help you with. But for your benefit, I'm going to leave one technique, for anxiety, and then maybe a couple or two things for stress, and then wrap up with a note on depression as well. So anxiety, what I would suggest is trying square breathing. What do we mean by squared breathing? Squared breathing refers to breathing in for 4 counts, holding your breath for 4 counts, breathing out for 4 counts, and staying for 4 counts. So like a square, in that rhythmic way, we consciously practice breathing. Breathing in for 4 counts, we hold our breath for 4 counts, exhale for 4 counts, and then stay for 1, 2, 3, 4, 4 counts again. Okay, so doing this kind of rhythmic breathing, for half a minute, 1 minute, 2 minutes, or as much time as it takes to calm down, is one thing that I would strongly recommend to help with anxiety. Okay, studies have also found this to be particularly helpful in terms of calming down when there is anxiety. Now, if we look at stress, two things. First is abdominal breathing. Now, in periods of increased stress, okay, which even you all might have if it's exam phase or placements or whatever, right? During increased periods of stress, what people can do is try abdominal breathing. Very simple technique. Basically, you breathe in from your via your nostrils. So breathe in through your nose, and your abdomen. Put your abdomen out. Your abdomen expands like a balloon, essentially. And when a balloon is filled with air, what happens? It expands, and then when the balloon is deflated, it collapses, right? So similarly, when you breathe out, your abdomen goes in. It deflates. You take your abdomen in. Breathe out gently through your lips. Okay. So if I have to, I'll explain it again. With you can see me doing it. When you breathe in through your nostrils, with your abdomen expanding. And remember, we don't want too much of chest motion, because if you're going to be moving your chest more or breathing in shallowly from your chest, it could very well feed into the anxiety or the stress that you're experiencing rather than reducing it. So when you breathe in through your nostrils, abdomen comes out. Breathe out, abdomen goes in. Breathe out gently through your lips. Okay, so I'm going to show that to you. You can place one hand on your chest and one hand on your abdomen. Okay, you can try this alongside just to make sure that your abdomen is expanding more than your chest. Okay, and if you find it's the other way around, because very often we are breathing with chest movement more than abdomen, we are breathing shallowly, then stop, start again. Put your abdomen out consciously. Breathe in. Slowly breathe out. Breathe in deeply. Expand your abdomen as much as you can. Slowly breathe out through your lips. Gently. If there is a candle flame in front of your lips, it should just sway, not get put off. So no breathing out like this. That's not what we want. Gently. Okay, breathe out. So this is abdominal breathing, right? As you practice this repeatedly, so typically what we say is if you're going through periods of high stress or anxiety, this works even for anxiety. It helps to relax. It turns off the fight or flight response. Do this 8 to 10 times every 3 hours. 8 to 10 times every 3 hours, especially during times of heightened anxiety and stress. But if generally you just want to keep tabs and help yourself through your fast-paced life on a day-to-day basis, just do this maybe once you wake up during the day, and then at the whenever you get a break, and then before you go to bed as well. It will help you release some of that pent-up stress. It will help your system, mind and body relax. Okay.
Yes, ma'am. In these COVID times also, it is very much important.
Very much needed, because again, COVID is something which physically breathing gets affected many times. But more importantly, whether you get it or not, this whole aspect of pandemic can provoke a lot of anxiety. So well said, Prabal. Okay, so this is something that you all can try, and it can also be of help for people with eczema to cope. Okay, now apart from this, spending time in nature, then I don't know how many of you are familiar with mandalas. How many of you are familiar with mandalas?
No, ma'am.
No one has heard of mandalas? Okay, so mandalas are essentially anything that you put into a circle. A circle, psychologically speaking, is said to be a safe space, confining within it whatever you put into it. So from an art therapy point of view, if you do mandalas, that could be coloring mandalas or drawing mandalas. It does not have to be a masterpiece in terms of artwork, but it's just about doing patterns inside circles which you find interesting, coloring inside circles however you want, spending a few minutes doing that every day. Research shows that that also is calming, especially when there is anxiety. Okay, and not just that, even if people, without eczema, if we're living our we're living our normal day-to-day lives, which is quite fast-paced, even then doing mandalas is shown to foster your mental health. So if you want to, and then again, left brain, light brain stimulation, boosting creativity. So mandalas again are something that you can look up. So if you don't know where to start, there are also mandala coloring books that are available. So you will find that some people buy that and also color into it if you don't want to go into that whole thing of drawing it by yourself and doing it. Okay, so that's another input for well-being and anxiety. Lastly, I think apart from that, spending time in nature has also been found to reduce anxiety and stress. Of course, as long as that any trigger in outdoors or nature is not an allergen for you or anything like that, then people with eczema could also benefit from that kind of relief that nature or spending time in nature gives. Lastly,
Yes,
now depression. It's depression is again complex, especially if you're looking at clinical depression to explain for me to explain coping with in terms of this session, because that's something that again therapy would definitely be required for, right? Why therapy? To address whatever thoughts in our mind that are affecting us, contributing to that distress, which we are preoccupied with. So in case of eczema, again, there could be shame, there could be that being very self-conscious, not feeling like others will comment or judge, feeling hopeless about having to deal with it, fatigue. So for all those kind of cognitive aspects, those disturbing thoughts, disturbing emotions, as well as behaviorally, avoiding interacting with people, avoiding work, or avoiding going out, or not being able to keep up with academics, those kind of problem behaviors or problematic aspects practically can also be addressed through therapy, especially cognitive behavioral therapy, for the kind of distress and impairment that depression brings. Having said that, even due to anxiety or stress, if there is significant impairment and in functioning, right, your social functioning, your occupational functioning, and your physical functioning, if there's significant distress that you feel emotionally associated with it, seek help from a mental health professional, be it a qualified counseling or clinical psychologist, a psychotherapist, or a psychiatrist. With or without eczema, if you notice that this is there, do get help, because ultimately we are the ones who can help ourselves first. Everybody else exists as support systems, personal and professional, to help you out, right? And one thing that I think definitely can help is also to keep in mind your strengths. No matter what toll anything or even eczema takes on your self-esteem, in terms of physical appearance, you feel it has made an impact. Make a note of your strengths that actually, when I say strengths, your qualities, your skills, your capabilities, whatever you've been able to achieve, that can take you far in life. That there are a lot of aspects within you, resources within you, which can also help you to empower you towards whatever your aspirations and goals are, no matter what impediments or problems that a condition like eczema or other stressors, difficulties could bring about. So it is important not to take eczema lightly, and early intervention ideally, and at the same time remember the mental health aspects and seek help, learn self-care, coping measures for oneself in order to reduce the triggering of eczema and reduce the distress that we go through, and also function better, have a better quality of life. Okay, so on that note, I wrap up this presentation. and hope that you have different takeaways from our session today.
Yes, ma'am.
Yes,
Sure.
ma'am, of course.
We had a lot of new information which we understood today. Thank you so much, ma'am, for that.
Thank you, ma'am.
Thank you.
So,
It's a great session, man. Really, thank you.
Thank you, ma'am.
Glad
ma'am,
to hear some of your feedback.
Sorry, ma'am.
Thank you so much, ma'am, for the great session, ma'am. It was really lovely.
we learned a lot, ma'am. I mean, we don't know much about eczema,
And
but now
yeah.
we do.
Glad. Thanks for sharing your feedback. Happy to hear.
Thank you so much, ma'am, for taking out your valuable time
Thank you, ma'am.
for interacting with us.
Thank you so much, ma'am, for preparing this PPT.
Yes, ma'am. So, ma'am, at last,
I'm happy to convey it to you clearly, and the ultimate thing is, firstly, I think my deepest appreciation and compliments and respect for DORAI Foundation for taking the initiative to carry out programs like this, which spread awareness about health conditions like this, which might otherwise may not be
neglected.
Yes, might otherwise get neglected, may not get the kind of care that it requires, and people with it may not get the kind of support that it requires. So in terms of generating awareness and sensitivity towards these kind of issues, as well as highlighting the importance of mental health in coping and having a good quality of life, even if we have different challenges, I think I have my deepest appreciation and respect for the DORAI Foundation for doing that.
Thank you so much, ma'am.
Thank you so much.
Thank you, ma'am.
Thank you.
And we can stop sharing your screen, ma'am. We have to show the certificate.
So are we going to be announcing the name of the prize winner?
Yes, ma'am.
Yes, ma'am. Ma'am, can you please stop sharing the screen? Someone else has to do that now.
Sure. 1 second. Yeah.
So this is.
Okay. So should I just go on and announce?
Yes, ma'am.
Okay.
Yes, ma'am.
So congratulations, Anjali Jose, for you
E-quiz.
winning the 3rd place on the e-quiz on dengue and malaria conducted by DORAI Foundation Health Fest on 3.0. Yes.
Yes, ma'am.
Okay, congratulations, Tejashwini Singh, for winning the 2nd place on the e-quiz on dengue and malaria conducted by DORAI Foundation Health Fest 3.0 2022 again. Okay. Last but not the least, congratulations, Chandran Kumar Das, for winning the 1st prize on the e-quiz on dengue and malaria conducted by DORAI Foundation Health Fest 3.0 2022 again.
Thank you so much, ma'am.
Thank you
Thank you
all.
very much, ma'am.
Which we held yesterday. So yesterday's topic was physical fitness in dengue and malaria. So the quiz was on the same topic. Today we are going to have psychology on eczema quiz.
Interesting. So all the best, and I think concluding from my end, very happy to see all of you. I think in this pandemic, just seeing new faces, interacting with people has become so rare. It's been, I think that's something that I've really enjoyed, and the fact that many of you have turned on your video, it makes it much more interactive. And in real time we get to see y'all and understand how you are receiving it as well. And thank you for also being vocal in terms of sharing, in terms of how you are processing what we've discussed and sharing your feedback. And I wish you all the very best with all your endeavors going forward. And to the organizers of Health Fest, this session, Prabal team, everybody, good job done. Keep it up.
Thank you so much, ma'am.
Thank you so much, ma'am.
Thank you, ma'am.
It was great having you here with us, ma'am.